One of the signs of being a type 2 diabetic is getting up and going to the bathroom 2, 3, 4 times a night. That was me. And I'm thinking, man, did I drink all that?
I think I became concerned when my aunt, who's only 7 years older than I am, was diagnosed with it. And she was diagnosed with it when she was in her early 50s. And as I approached and past that age point, I became concerned because I was overweight.
Diabetes can be confusing, even frightening. But to relieve this confusion, you need to know, what is diabetes? The most common form of diabetes is type 2 diabetes. That's what we'll be talking about. It usually occurs in adults after the age of 40. However, there has been a rise in the number of cases of type 2 diabetes occurring in children and teens. Being overweight increases your risk. Diabetes affects the way your body uses the food you eat. Most of the food you eat changes to glucose, a form of sugar. Glucose enters the bloodstream, causing your blood glucose level to rise. As your blood glucose rises, the pancreas releases insulin. Insulin works like a key to open the cells and let glucose enter. The glucose is used for energy or stored for later use. Normally, our bodies maintain a balance of glucose and insulin in the bloodstream. In people who don't have diabetes, the body maintains the right amount of glucose in the blood by releasing the right amount of insulin at the right time. This means that no matter what you've eaten, your blood glucose level stays between 70 and 140 milligrams per deciliter. But when you have diabetes, your body can't keep your blood glucose in this healthy range without help. Your pancreas might not make enough insulin. Or your pancreas might not release insulin soon enough after you've eaten. Your liver might release too much stored glucose into your bloodstream. Or your cells may have trouble taking in glucose because they can't use insulin. This is called insulin resistance. In any case, glucose has trouble entering your cells, and with nowhere to go, builds up in the bloodstream, leading to high blood glucose, or hyperglycemia. The higher your blood glucose goes, the more likely you are to develop symptoms of diabetes. The symptoms of high blood glucose include fatigue, blurred vision, frequent urination, and thirst. But many people with high blood glucose don't notice any symptoms. Often they don't realize how badly they feel until the diabetes is controlled. With or without symptoms, high blood glucose can be a problem. Having too much glucose in your blood over a period of time can cause very serious long-term health problems. High blood glucose damages the large and small blood vessels of your body and the nerves. Damage to the large blood vessels can lead to poor circulation, heart attack, and stroke. Damage to the small blood vessels can lead to eye disease and kidney disease. Nerve damage leads to pain, loss of feeling, and muscle weakness, usually in the hands, legs, and feet. Together with poor circulation and skin breakdown, this can lead to the amputation of a toe, foot, or leg. But these things do not have to happen. You can reduce your risk of developing complications by keeping your blood glucose in your target range. You and your diabetes care team will discuss your blood glucose goals and determine a target range that's right for you. Members of your diabetes care team may include your doctor, nurse educator, registered dietitian, exercise specialist, pharmacist, podiatrist, ophthalmologist, social worker, and counselor or psychologist. all of whom may be certified diabetes educators, or CDEs. Together with your healthcare team, you'll learn about your management plan. It will include learning all you can about diabetes, making healthy food choices, physical activity, medication if necessary, and monitoring your blood glucose. Making healthy food choices is one of the best ways you can manage your blood glucose. In most cases, this helps you lose weight as well. One of the first steps you may take is to meet with a dietitian to develop a meal plan that is tailored to your needs. But this doesn't mean you have to go on a boring, uninteresting diet. It just means developing permanent healthy eating habits. Habits everyone can benefit from, like total carbohydrates count, control your portion sizes, and choose fats wisely. First, total carbohydrates count. Carbohydrates are found in a wide variety of foods, such as breads, cereals, pastas, and whole grains, fruits, vegetables, and beans, dairy products, candy, and desserts. Carbohydrates provide your body with the energy it needs to do its work. When you have diabetes, too much carbohydrate may cause your blood glucose to rise out of your target range, so it's helpful to be aware of how much carbohydrate is in the food you eat. Talk to your diabetes care team about how much carbohydrate is best for you each day. Healthy carbohydrates like whole grains, vegetables, and fruit are high in fiber and tend to fill you up while not raising your blood glucose too fast, a benefit when trying to manage your diabetes. Learn what portion sizes are best for you to help control your blood glucose. In the beginning, you can use a scale and measuring cups to get an idea about portion sizes. Choosing fats wisely means eating foods low in fat, like skim milk, low-fat margarine, and low-fat salad dressing, instead of high-fat products such as butter, cheese, and whole milk. And substituting lean meat, skinless chicken, or fish for high-fat meat products like sausage, bacon, hot dogs, salami, and highly marbled cuts of beef and pork, fatty sauces, and gravies. Add fats that are heart-healthy to your meal plan. They're called monounsaturated and polyunsaturated fats and can be found in nuts, seeds, canola oil, and olive oil. Finally, stay away from foods prepared with fats and oils high in saturated fats and trans fats, especially fried foods. You can bake, broil, steam, or microwave foods. Increasing the amount of physical activity you do can help manage your blood glucose. Physical activity can also help you lose weight and can reduce your risk of heart disease. A good goal is to get between 30 and 60 minutes of moderate activity on most days. But if you're trying to lose weight, you may need more. Talk to your healthcare provider about setting an activity goal that's right for you. Try some aerobic exercises, such as walking, cycling, or swimming. Find an activity you like and stick with it. Also, try to work physical activity into your daily routine. For example, walk to the store instead of driving, or use the stairs instead of the elevator. Anything that keeps you on your feet and moving will help lower your blood glucose and reduce your risk of heart problems. Your healthcare provider may prescribe medication if healthy food choices and physical activity don't keep your blood glucose in a healthy range. This medication may come in the form of pills, which help your body make or use insulin, or it could be injections of insulin or other diabetes medications. Based on your blood glucose results and your eating and living habits, you and your diabetes care team can determine which type of medication is best for you. But remember, even if you take medication, you still need to make healthy food choices, increase your physical activity, and check your blood glucose to see how well your management plan is working for you. Checking your blood glucose involves home blood glucose checks, as well as tests performed by your diabetes care team. Home blood glucose checks usually involve taking a small amount of blood and placing it on a test strip that is inserted into a home glucose meter. To show how well your blood glucose has been managed during the past 6 to 8 weeks, your diabetes care team will perform an A1C test. You should receive this test at least twice a year. To maintain your overall health when you have diabetes, learn more about the importance of skin and foot care, eye exams, your heart health, and dental care, because people with poorly controlled blood glucose are more likely to suffer the long-term complications of diabetes. High blood glucose levels are more likely to lead to infections, which heal very slowly. Taking good care of your skin can help minimize this complication. The feet in particular should get special attention since minor irritations can turn into serious problems. As we've said, having too much glucose in your blood for a long period of time contributes to heart disease. The exact connection between diabetes and heart disease is not yet clear, but we do know that it's related to high blood glucose, high cholesterol and/or triglycerides, and high blood pressure. By keeping your blood glucose in your target range, your blood pressure and cholesterol in a normal range, and not using tobacco, you are doing a great deal to lower your risk of heart disease. High blood glucose levels can affect your eyes, so you should have an eye examination each year by an eye doctor called an ophthalmologist. This checkup should include an examination of your retinas through dilated pupils. Good dental care is also important. To make sure you've gotten the important points, let's review. When you have diabetes, too much glucose, a form of sugar, builds up in your blood. This is called high blood glucose or hyperglycemia. Work with your diabetes care team to get your blood glucose back into your healthy target range. Your management plan is your guide. Learn all you can about diabetes. Make healthy food choices. Get regular physical activity. Monitor your blood glucose. And take medications if you need to. Following your management plan will help you feel better today and also help prevent or delay diabetes complications so that you can enjoy a better quality of life.
My advice is to have a plan, a daily plan, and keep in mind that you're here in this life for a purpose, and that people loves you, you have family, you have friends, and diabetes is a disease that you could control. Diabetes cannot control you, but you could control it.